Hello and welcome. Thank you for joining us for today's webinar. My name is Michelle Zepeda, and I'm the Program Coordinator at Waterford Place Cancer Resource Center. Waterford Place provides programs and services free of charge for anyone impacted by a cancer diagnosis that supports whole person care. I would like to introduce our speaker for today, Mariana Martinez from Rush Copley Medical Center. Mariana is the Community Health Outreach Coordinator for the Rush Copley Cancer Care Center. She is a certified health education specialist. She received her Bachelor's of Science in Public Health with emphasis in health promotion from Northern Illinois University. Thanks, Mariana.
Thank you, Michelle, for that introduction, and thank you all for being here this afternoon. Like Michelle said, my name is Mariana Martinez, and I work at the Cancer Care Center here at Rush Copley, and my role has recently expanded into other departments within the hospital as well. Today, we're going to do a brief presentation on how to form your genealogy tree, and more than anything, specifically amongst breast and ovarian cancer patients and things that they need to look out for in communication within their family as they are forming this tree. So before we get started, this is completely optional, but I thought as we're taking notes and we're going to be talking about kind of identifying family members, it might be nice to go ahead and get started and getting those tools and that information needed as you're going to be forming your genealogy tree. So if you want to just have a piece of paper, a notebook, pen or pencil just to write notes, there's going to be nothing collected. It's more just for you as we're kind of going through this presentation. So you can start writing down or maybe making notes of maybe phone calls you might need to make, or just things to look into a little bit more. So the three areas that we're going to cover is why is this important? How do you identify family members? And then going on to forming your own genealogy tree. So again, why is this important? So a genealogy tree can look very different depending. Most of the time, especially if we've done it or we've assisted maybe children or family members forming a family tree for a project, it might look very similar to the one that you see on your left-hand side. Pictures of family members with their names and kind of making a tree and branches. And it might look different, but it really looked more like a tree and you're identifying those that are members of your family. But if maybe you've gone through cancer treatment and you've been recommended a genetic test or you've sat down with a genetic counselor, it might look more like the one on the right-hand side, and that's called a pedigree. So it means the exact same thing. It's just more of the medical terminology that we use to identify patients that potentially might be candidates for genetic testing, or if we just really want to look at a patient's individual family history and being able to track that a little bit more. So they're both very similar. They might just be tracking information in a very different form to be able to communicate some of your medical history as it relates to cancer treatment. As it relates to cancer, sorry. So why is a genealogy important? You learn more about your health risks. So you might learn more about what you have a family history of, or you might have more risk factors for. You're able to document your health history. Better communication with your team. I don't know how many times it's happened to me when I go to the doctor and they're asking me in the middle of my appointment, hey, so anything different in your family? And I'm trying to remember a year's worth of interacting with family and see if there has been any new diagnosis of anything. And it's hard to think about that a year back in that 30 seconds you have to kind of respond to that medical assistant or that nurse that you might be working with. So this is why it's good to maybe make notes and preparation either for your yearly visit, whether it's with your oncology team or your primary care provider. So it allows for better communication with your team, identify common cancers in your family. You might have not thought about it until you really sit down and look at the map that forms your family tree or your genealogy tree to see, you know what, there is a certain type of common cancer identified or something that I see within one side or both sides of my family. Being able to share information with your family. So this empowers you if you happen to be a cancer survivor or you just know that there's a strong family history in your family, then you can go ahead and share this information and said, you know what, I did this homework for my side. Here's what I have. Let's piece together and you can go ahead and start forming your part of your genealogy tree as well. Or communication for when our children are older and we're able to have that conversation with them. It can also help make decisions in your treatment plan. So if your physician does recommend a genetic test, the results of that genetic test might have implications in the type of treatment you would be receiving, maybe treatment-wise or surgery options that your provider or your team might recommend for you. And again, it will help identify if you might be a candidate for genetic testing. So if you have an up-to-date genealogy tree or family history, then it's easier for your team to identify if you are a potential candidate for genetic testing. And just, I don't want to dive into what genetic testing is. We definitely have a genetic counselor on site at the Cancer Center that can really dive into and go into detail what exactly a genetic test is and how it helps identify a genetic mutation. But a genetic testing, I just want to give a brief overview, helps identify if your breast or ovarian cancer was caused by a genetic mutation. Now, you need to look that only about 5 to 10% of all cancers are caused by a genetic mutation. So that is the reason that there is a criteria specifically for genetic testing. It's not necessarily done across the board for everybody. There are certain factors that need to be identified in you or your family history to make you a candidate or an individual that should have genetic testing. And they can be done through different ways. I'm sure you've seen commercials, especially around Christmas time when it's all those ancestries, those color, those genomic testing. But really the best thing to do is have a sit down with a genetic counselor and have that conversation, because you can mail those results in, but you can mail that sample in, but the results can have implications in your care or in your health. So you want to be able to have a counselor that can really sit down and have that conversation with you. But it can be done via a blood sample, or it can be done by a saliva sample. So a lot of those commercial products are the saliva sample types of genetic testing. And like I mentioned, more than anything, talking to your healthcare team. If you look back after you complete your genealogy tree and say, you know what, I clarified some information with some of my family members and this came up, do you think that I might be a candidate, or would you be able to refer me to a geneticist or a genetic counselor to be able to really look into my family tree or my genealogy to see if I'm a candidate for genetic testing? So now, how do I identify family members? So this comes up, and I've had discussions with my own family and who really forms my family. And when I'm looking at my genealogy tree, growing up, my mom or my parents would tell me everybody's my aunt and uncle, and I have so many aunts and uncles and so many cousins. But when it really comes down to our family tree, we need to identify who really represents our genealogy tree and their medical history, how that can potentially have risk factors for us within our cancer diagnosis. So we're going to look at identifying family members. We're going to focus on 3 specific type of family members. So the first ones will be looking at our first-degree relatives, our second-degree relatives, and then our third-degree relatives. These are the 3 groups we're going to be focusing on that will be forming part of your genealogy. So these are going to be those that are going to be forming branches and sections within your family tree or your genealogy tree as you're putting that together. So when we talk about our first-degree relatives, we are mentioning this is where we would include our parents. And then from there, we would also include our siblings, so our brothers and sisters. And then if we have children, we would also include any children that we might have. So as we get started, that's why I said it's nice to have a piece of paper. Just write down the names. Right now, don't necessarily put them in a tree or put them in a specific format. Just write them down and say, these are my first-degree relatives, their names, and who they are specifically. Then our second-degree relatives. This is where we will note our grandparents, both maternal and paternal. And then we will also go ahead and put down our grandchildren. We'll also put aunts and uncles, maternal and paternal, nephews and nieces. And our second-degree relatives, that's where our half-brothers and sisters also would be identified. And then third-degree relatives. This is where you would make notation of our first cousins. So make a list of our first cousins and who exactly falls under that. Our great-grandparents, both maternal and paternal, and then our great-grandchildren we would also identify within this area. So these are the 3 groups of relatives that we would be using to form our family tree or genealogy tree and be able to communicate this information to our team, or just keep it for ourselves for our own medical history. So now how do we move on and begin to form our family tree? So you're going to begin with yourself. So you're going to note your current age, if you've been diagnosed with a certain type of cancer, what type of cancer you've been diagnosed with, and specifically the type. So most of the time we say it's breast cancer, but what type of breast cancer you specifically have, whether it's triple negative, whether it's estrogen or progesterone positive or negative. That's some of that information that we're looking for. The age that you were at the time that you were diagnosed. Note if you have more than one cancer diagnosis. So if you've been diagnosed with a breast cancer and then later on diagnosed with a different type of cancer, or the other way around, you've had other types of cancer, now you have breast cancer. So being able to note the specific types of cancer that you've been diagnosed with. Note if you are of descent of Ashkenazi Jewish, there has been linkage with certain types of mutations linked to this community. So those are one of the common questions they might be asking you. And then also just being able to note the country and the state of origin that we're from. So this is very important, especially where our family history might be from different countries. So these are specific things we might want to note on our family tree to be able to track. And now information that we're going to need from our family members. So we're going to have to get some of this information specifically from, you might need to make phone calls, we might need to reach out or get clarification on what maybe some of our family members types of cancer they've had. So just think about that conversation with family members. Sometimes it can be a bit challenging. So not everybody's willing to share maybe what they've gone through or what type of cancer they've had. So just be ready to possibly respect certain individuals' boundaries, or just think about the way you're approaching that conversation, making sure it's not on Thanksgiving dinner or at a birthday party, that you're truly kind of sitting down maybe over a cup of coffee or over the phone or via some type of virtual portal now to be able to connect with that family member and really explain why this is important to you for your own health history. And that way they might be willing to understand that a little bit more and are willing to share. But there are situations where there are certain family members that might not necessarily be willing to share, or even being able to share kind of any type of genetic mutation that they might have identified as well. So just be ready. It's not going to say that it's always going to happen, but just be prepared for some hesitation in case that were to happen. But really just to pick the appropriate time and place to have that conversation with your loved one. What you're going to want to capture from family members, specifically when it comes to breast and ovarian cancer, just any type of cancer they've been diagnosed with, and specifically the age of diagnosis. So if you know that they've had a male in your family has had prostate cancer, figuring out what age they were when they were diagnosed, and if you can, what type of prostate cancer that might have been. And then also you want to indicate if a family member has passed away. You want to identify the age of that family member at the time of them passing. And then what did they pass away from? Whether it might be an illness like a cancer diagnosis or some type of other condition, or if it was an accident or any other reason that that individual might have passed away. Now, if they were diagnosed with a cancer, kind of the same two bullet points applied before, what type of cancer it was, and the age of diagnosis. So you would need both the age of diagnosis and the age that they might have passed away from that cancer. And sometimes you won't have everything. I know definitely when I have this conversation with more on my father's side of the family, I think every single time I ask my dad what type of cancer my grandfather passed away from, it kind of changes. It goes from prostate to stomach to pancreatic. So sometimes we're just poor historians and we don't know exactly. Or if you go back and think to for my grandparents or great grandparents, a lot of this information wasn't shared, or they really didn't know what they might have passed away from. They just know they passed away from on a certain date, they felt this certain way, they were complaining of certain pains, and then later on they passed. So we might not have all of that information, but whatever we are able to gather, just write that down to be able to share with your team or with your provider. And now important information to kind of just make note of, and you might just want to use a red pen, or maybe you want to use something to maybe circle or highlight. So definitely when we're looking, when I said common cancers that could possibly happen, just kind of little red flags is kind of common cancers that you might see in multiple sides of the family is breast, ovarian, pancreatic, prostate, melanoma, and those are just to name a few. It's not limiting to only these on the list, but these are some of those common cancers. And they might not, I know we mentioned this is specifically around breast and ovarian, but there are certain types of other cancers that also kind of you see a correlation with breast and ovarian when it comes around some type of genetic mutation. But they ask several questions just to make sure they have everything that they have within your family history. Any family member with ovarian cancer, regardless of their age, a male family member with breast cancer is something that we really is a little red flag. Family member with breast cancer before the age of 50, and a family member with multiple breast cancers. So they've had different types of breast cancers, one in each breast. Now, it's not to say that for sure this is a genetic mutation. These are just kind of red flags that maybe your team will then prompt you to possibly go ahead and talk to a genetic counselor or geneticist to further look into, ask those additional questions. But it's nice to have this genealogy tree to be able to present and say, look, I've done my homework. This is the information that I have. And they're able to make better decisions when it comes to certain types of exams or genetic testing that they might recommend. So now we can go ahead and begin. And this is when you would begin to form your genealogy tree. So identifying those family members that you had in that list, those first degree relatives, second degree relatives, and third. So it might take some time. You might have to make some phone calls, like I mentioned, in case you happen to not have all that information on uncles or on your extended family members that form part of your genealogy. But once you do have that information, you're going to want to go ahead and get started. And like I mentioned, you would start with yourself and from there branch up moving forward. And for your specific genealogy tree, it will only be you and then moving up from your first, second to third degree relatives. But then if you do happen to have children and you want to start including your children, then in your children's genealogy tree, that's when your significant other's genealogy also will come into play. When you start adding your children and you want to be able to connect that for them if needed. But really forming your genealogy tree allows you to have a conversation with family members, share information with your medical team. And just as a reminder, we started off with kind of common questions that your care team might ask you at yearly appointments. They're going to ask if there's been any change in your family history or even your personal history. So point of time where you want to make sure maybe you will review it either at the beginning or at the end of the year, having that conversation with family members or just learning a little bit more of your family members if you've noticed anything different, if there has been any change. So you want to make sure you're updating it on a year basis just to make sure you're capturing and you're keeping it up to date as possible. And like I mentioned, it can look very different depending on what you feel more comfortable. If you want it to look more like the one that's on the upper right-hand side, it looks more like a family tree or kind of more like just branches, having a family tree in the background and just having those circles or those areas where you can identify family members. And that is the end. So I'll go ahead and take any questions if anybody does have questions. I hope it allows kind of setting down the baseline information to go ahead and start forming that genealogy tree for your own personal history. So thank you.
Thank you, Mariana. We do have one question that came through earlier in the presentation, and that is, are the blood and saliva home test kits as good or reliable as doing the test with a geneticist?
I'll have to check the reliability. I think it just depends on the brand and the specific type, but they really recommend for you to have some type of counseling. Either some are over the phone or virtual, depending. Some insurance companies do dictate, but I think they really recommend the blood one if possible. But some of the saliva ones, depending on the specific company, can be just as compatible. But I would just be hesitant on which specific brand that you're utilizing and their limitations on the types of genetic mutations that they're looking at. Because there's difference between individual testing and then panel testing, which panel testing looks at multiple genetic mutations within your own sample. So that's where it might be a little bit trickier, where you just need to make sure you're doing the right test for what result you're looking for, what genetic mutation you want to rule out. But I can confirm and look back, and I can check with our genetic counselor to to our genetic counselor, just confirm which ones are those that are the best compatible to the blood sample ones. But I know some of the genetic testing companies have some saliva sample ones.
Thank you. Are there any other questions for Mariana? You can put them through the chat.
Well, hoping that this allowed to kind of start setting your baseline and information on your genealogy tree. Has anybody been able to put that together in the past or seen a genetic counselor and having that conversation?